In our era, when public health systems are stretched to their limits, AI and geospatial technologies allow us to maximize our expert human resources despite limited financial resources. They transform our vast data repositories into actionable insights. By harnessing these cutting-edge technologies, we can predict outbreaks, optimize resource distribution, and in the end, save lives despite, again, limited resources. We have limited financial resources that severely limit our program's effectiveness and reach. We have an obvious shortage of skilled professionals in the field. There's inadequate infrastructure, the number of the facilities, especially in certain healthcare deserts. And in addition to these straightforward resource limitations, we have IT limitations. So for AI and geospatial technologies, data analytics to be really effective, we need good quality data. And a lot of times we're lacking in, we have outdated systems and so not always the knowledge we need to acquire data in the right way that we can take advantage of modern data analytics. And in addition to these two, we have supply chain issues. So supply chain issues commonly slow down the distribution of medical equipment and needed medical devices. The healthcare industry has a critical shortage of skilled professionals, including doctors, nurses, clinicians, and other public health experts. So consequently, technologies designed to amplify the effect of these skilled professionals are not just beneficial, but they're crucial. My focus area is on utilizing AI and geospatial technologies to improve public health outcomes, despite some of these resource-limited settings. I was a consultant for WHO, where I used data science to analyze and predict disease spread over a continental scale. In addition, I used machine learning for text classification to detect news articles relevant to disease outbreaks. And in the past, I contributed to a project, Sense Place 2, Sense Place 3, which enhances crisis management through geovisual analytics applied to social media data. So this work demonstrates substantial improvements in data-driven decision-making and resource allocation in public health. Public health organizations face financial limitations, time pressures, and shortages of skilled workers. In addition, there's infrastructure issues, inadequate physical and technological infrastructure. In addition to this, we have logistical challenges, which are even more noticeable in remote or expensive regions of the world. So all of these resource challenges are then amplified by data management issues, outdated systems, and this creates a cycle where public health organizations are always responding to current challenges and not innovating for future to minimize future issues. To break this cycle, we need strategic focus for innovative solutions and strategic collaborations to optimize our resources. Geospatial technologies and AI, or GeoAI, can revolutionize the public health sector. They can analyze vast amounts of data, detecting patterns or doing predictive analytics. They can improve decision-making using data-driven decisions. They can also provide critical insights into the geographic distribution of diseases. Also, resource allocation. They can aid in optimizing resource allocation. And finally, they enable more targeted and effective public health responses using this, a lot of data, especially geographic data, to maximize our resources. GeoAI helps with predictive analytics and forecasting outbreaks that then, therefore, we can optimize our resources. In addition, geospatial technologies can pinpoint critical areas where health resources are needed. AI-powered systems can help train our professionals, maximizing resources where the AI using augmented or virtual systems can help train our professionals. And GeoAI, especially AI, can automate tasks where some of the less skilled professionals can maximize their efforts to help the fewer skilled professionals. Not just predicting major outbreaks, but GeoAI can help modeling some of the health trends going on in our world so that then we can take action ahead of time. It can help with supply chain optimization. This is something especially geospatial technologies have a long history of involved in optimized routing. And combining the geo with the AI really scales this route optimization. And all of these technologies really help us overcome the resource limitations that we're currently faced with. In addition to what I mentioned about solving some of these straightforward problems, GeoAI really allows us to scale some of our solutions, both geographically and temporally, where data analytics, route optimization can be developed for one area, but then applied globally, and can be updated on a regular basis temporally because these are computer-driven algorithms. I'd like to highlight one project I was involved with, SensePlace 2, SensePlace 3, to utilize these technologies to overcome public health resource constraints. SensePlace 2.3 harnessed AI and geospatial technologies, geospatial data, geovisual analytics to improve situational awareness for crisis events. It allowed for analysis of large volumes of social media data, as particularly Twitter, and doing this analysis in real time. And it focused on both explicit geographic information, so where are people tweeting from, but also implicit geography. So where are the places that people are talking about that need help? Where are the people located that need help? And where are the places that people are talking about affected by crisis? It allowed for filtering and prioritizing information in this vast quantity of social media data that's coming in at a high volume in order to pinpoint derived knowledge to take action. These real-time insights into specific areas of need and conditions really enhance resource distribution. And timely, location-specific information significantly boosts resource response effectiveness in these times of crisis. In addition to SensePlace 2, SensePlace 3, the Pennsylvania and US Cancer Atlas was an online tool really focused on the geovisual analytics side of things, where presenting cancer data in a very friendly visual way that not only allows people to understand things quickly, but allows people to understand accurately the data. So this can really support policy making, real-time surveillance, and do this in a user-friendly interface. The Cancer Atlas and similar tools can also be used as an educational tool. So once again, to maximize our resources, our limited financial resources, to better educate not only skilled health professionals, but through the spectrum, down to the general public. So what is the path to take advantage of GeoAI to maximize our resources? Well, one of the first things to do is invest in IT infrastructure. I've been in positions in the past, both where technology was heavily invested in and where technology was not. And I saw really firsthand where innovation can thrive, where you have the proper the proper hardware, and and where you don't have the proper hardware, where it could really inhibit innovation. And you need to invest in the proper GeoAI software and systems, and really focus on the data quality, the data harvesting, collecting the data in the proper way, making sure the data is comprehensive and also of high quality, so that then the analytics can be effective. Then pilot GeoAI projects. I was involved in one recently for WHO, can really be effective in showing the power of these capabilities. And in addition to investing in your own data collection, you need to consider integrating other data streams, whether those are freely available data streams like remotely sensed data from NASA for analyzing, predicting disease outbreaks, or social media data, or it can even be if it's valuable enough, paid data. And throughout all of this, you need to really prioritize both privacy and security, so that there's no privacy or security events that affect progress. So then skill development, both in IT professionals, but also too in the healthcare professionals, so that they can best utilize these GeoAI systems. And setting up regular monitoring and evaluation, and of course, proper evaluation metrics, so that you know the impact of these systems. And I really encourage collaboration and knowledge sharing. I've been in situations in the past where being part of a collaborative team really propels innovation. And in addition, I've been in a position where others who have created knowledge have shared that with the community, both whether it be data or software, and then that I've taken advantage of to once again create innovations that enhance public health outcomes. Budgeting, training, and most of all, partnerships are key to incorporating GeoAI into public health. Partnerships can bring innovative practices and facilitate cost sharing, making investments in these advanced technological projects more feasible. Future advances in GeoAI technologies will significantly enhance public health outcomes by improving predictive analytics for real-time disease surveillance, increasing spatial and temporal resolutions and coverage of our data sets for precise mapping, and automated data collection using advanced remote sensing and Internet of Things. These technologies will facilitate more personalized healthcare interventions and efficient data integration across diverse sources. Future advances in cloud computing will allow scalable, high-performance solutions even in poor resource settings. Alongside technical improvements, ethical considerations and enhanced data privacy measures are crucial. These issues are often mentioned, especially in the media, and if we emphasize training and mandate proper ethics and privacy, I will tell you that there's solutions for our current issues. And I'd like to emphasize that continuous innovation and adaptation help public health systems stay effective and responsive to new challenges and technological shifts. In summary, GeoAI can help us overcome resource limitations by optimizing resource allocation, improving outbreak management through predictive analytics, and enabling real-time disaster surveillance for efficient, targeted interventions. And embracing innovative solutions is crucial for achieving sustainable health outcomes. I urge public health leaders to strategically adopt GeoAI technologies as essential tools for to overcome resource limitations.